Assalamu alaikum. Welcome all to Easy Human Anatomy channel. Today I discuss internal jugular vein. Internal jugular vein are paired venous system drain blood from the brain, face and neck. This is cranial venous sinuses. This is superior sagittal sinus. It continue as transverse sinus, then sigmoid sinus, and inferior petrosal sinus. It leaves the cranial cavity through jugular foramen and the internal jugular vein is formed. The vein travel in the neck with the carotid sheath along the common carotid artery. This is the common carotid artery. This is internal jugular vein, and posterior to the internal jugular vein, this is the location of the vagus nerve. All are the content of the carotid sheath. Here, this is laryngeal prominence. At the level of the laryngeal prominence is the cervical 4, and in this cervical 4 level, bifurcations of the common carotid artery is occur, and just lateral to it, the internal jugular vein is present. It is a very important landmark to identify internal jugular vein. So this is common carotid artery, the internal jugular vein situated just lateral to it, and at the level of the cervical 4, the common carotid artery bifurcate. The terminal part of the internal jugular vein. The internal jugular vein continue inferiorly until it join with the subclavian vein, forming the brachiocephalic vein. And this junction, it is near to the medial end of the clavicle. Now the tributaries of the internal jugular vein: the middle thyroid vein, superior thyroid vein, lingual vein, common facial vein, pharyngeal vein, and occipital vein, and communication between external and internal jugular vein. Why internal jugular vein is so important? The internal jugular vein is commonly used for the central venous catheterization due to its size and accessibility. The jugular venous pressure serves as an indicator of right arterial pressure, aiding in diagnostic conditions like heart failure. So, to identify heart failure, the pressure of the jugular vein has to measure. The condition like thrombosis or compression can impair venous drainage, leading to significant clinical symptoms. The internal jugular vein is identified on ultrasound, CT, MRI, lying lateral to the carotid artery and compressible on imaging. Understanding the internal jugular vein anatomy and function is crucial for clinical procedure and diagnostic vascular pathology. In general, the diameter of the right internal jugular vein is larger than the left. The right internal jugular vein diameter is more than the left. The diameter can be increased during and in expiration, in the Tyndall birch position, during Valsalva maneuver, or while humming, which can be used to increase the success rate of common venous success rate of central venous catheterization. These are the important relations of the internal jugular vein. It lies deep to the sternocleidomastoid muscle. It cut and remove in this picture, and we also see two muscle is related with internal jugular vein. One is the posterior valley of the digastric muscle, another one is the superior valley of the omohyoid muscle, and it is posterior to it present the vagus nerve, and it's also related with another two nerve, the spinal part of the accessory nerve, and inferior root of the ansa cervicalis muscle. And it's situated just lateral to the common carotid artery, and two of the branch of the external carotid artery is also related here, the posterior auricular artery and occipital artery. You can find easily the internal jugular vein in between the two head of the um, origin of sternocleidomastoid muscle. You know the sternocleidomastoid muscle is originate from both sternum and from the clavicle. This is the sternal head, this is the clavicular head. The in between there is a gap or depressed area, and the lower base part is um, formed by the medial end of the clavicle. So this gap, the apex of this gap is used for central venous catheterization. This is the fourth cervical vertebra and correspond anteriorly laryngeal prominence, or the just superior part of the laryngeal prominence, and at this level the common carotid artery is bifurcated and from external and internal carotid artery, and just lateral to it the internal jugular vein is present. So below this line, internal jugular vein is found just lateral to the common carotid artery. So this information is very important for internal jugular vein related procedure. Now the bulb. There is two bulb is present in the internal jugular vein, the superior valve and inferior valve. The superior valve is situated at the origin of the internal jugular vein within the jugular foramen of the skull. It is continuous with the sigmoid sinus of the dura mater above. It facilitates smooth blood flow from the intercranial venous sinuses to the internal jugular vein. This is internal inferior valve of the internal jugular vein, and it has valve, and it prevents rectocate blood flow from the subclavian vein to internal jugular vein. Understanding the location of this valve is essential to avoid complication during catheter insertion, and thrombosis in the valve can obstruct venous return, leading to the increased intracranial pressure or swelling of the head and neck. This is the CT scan. See the internal jugular vein, common carotid artery, internal carotid artery, and location of the internal jugular vein in MRI scan. This is a sonographic picture. This is the location of the probe of the ultrasound, and this is the procedure. This is internal jugular vein, carotid artery. So this is all about internal jugular vein. If you like this video, please press the like button. Please subscribe my channel. Thank you for watching.